A new report says Americans are having more cosmetic surgery, plastic surgery procedures, and the reason may come as a bit of a surprise. Joining us this morning, Dr. Joseph Michaels, a board-certified plastic surgeon with Monarch Aesthetic and Reconstructive Plastic Surgery in Bethesda. Good to see you again.
Thanks for having me.
So the relatively new data, it comes out and it shows that more of us are getting procedures done. Can you give us the big picture here? What's going on?
Right, for the second year in a row, according to the American Society of Plastic Surgeons, that the trend is that there's been a 5% increase in cosmetic procedures over the last year, and that's been for 2 years in a row now.
Very interesting reason why, and we've been teasing this. You might think it's for vanity's sake, and it might be, but it's mainly because folks they want to look good at work. Maybe they're getting back into the workforce or what have you, but they want to look good at the job.
Exactly. I mean, we're seeing two main reasons. I mean, there's definitely some improvement in the economy, and patients are having better, they're having improved disposable income, and so they're spending that money. But another reason is that the workforce is getting older. People are staying in the workforce longer, and they're also going back into the workforce, and they want to look younger, they want to be more competitive. And looking younger is really something that may help with their job security. So we are seeing an increase in patients coming for that reason.
Very interesting. You pass along the top 5 surgical procedures that people are doing now: breast augmentation, nose reshaping, liposuction, also eyelid surgery, which would speak to getting older, and facelifts, of course, and also the top 5 minimally invasive procedures that people are doing: the Botox, soft tissue fillers, the chemical peels, laser hair removal, and then microdermabrasion. This is just to, I take it, brighten up your appearance.
Exactly. The more minimally invasive procedures, like you mentioned, Botox, facial fillers, are really driving this increase. And these are mainly because there's low, the cost is better, there's very little downtime, and that's really important for patients, especially in the workforce. They can't take the time off from work. And you know, these are the real factors right now that are driving those costs, driving those procedures.
Let me ask you too, on the other side of this, you were talking about people maybe wanting to look their best, still working longer. What about the other side and responsibility, I would imagine, from board-certified plastic surgeons like yourself? When you see somebody coming in too young, how does that play out and how does that work? And are we seeing that too?
We are seeing some young patients, but again, plastic surgery is a very personal decision, and it really has to be done for the right reasons. And when we see a patient in our office, in my office, you know, we want to make sure that these patients have good, realistic goals and expectations, and they're coming in for the right reason. Patients who really should be doing plastic surgery for themselves, not to impress other people or for other secondary reasons. And so one of the things that I do in my practice, we really want to make sure that they have good goals and expectations, that I can really deliver what they want. And sometimes you have to turn some patients away. That's
interesting. And I guess let me ask, in the minute we have left, if you are out there and you're looking and saying, I've been thinking about doing this, what are the questions that you need to ask your doctor? I would imagine, are you definitely trained in this specific field, or what I want to get done? Pass along some more tips.
The best thing to do is really, patients should really do their homework before they come. They should know about the procedure. They should have questions to ask. They really want to know, they should have a good working relationship with that doctor. They want to know how many of those procedures they've performed. Are they a board-certified plastic surgeon? They want to see before and after questions, and really make that patient feel comfortable that they can deliver the goals that they're expecting.
Is this the kind of thing where we would also shop around? I would imagine you wouldn't want to get the cheapest thing if you have all of those other boxes checked. But can we do comparative shopping here, or is there standard prices that those folks out there should know and should go in expecting to pay?
I think there sort of is a market price, but different doctors do vary. I think if a price from a physician is well below what you've maybe seen from other doctors, you may really want to look into that doctor's background and really make sure that they are a board-certified plastic surgeon. And again, you know, the consumers really need to do their homework.
Okay, this is Dr. Joseph Michaels with Monarch Aesthetic and Reconstructive Plastic Surgery in Bethesda. Good to see you again.
Thanks for having me.
Tony, over to you.
The Fox 5 Weather app. Look 10 days ahead or hour by hour. View today's video forecast and radar that can pinpoint your neighborhood free at your App Store or Android Market.